Okay, good morning, everyone. Thanks for joining our RHP3 region-wide monthly call. We're going to give everyone just a few minutes to log in since I know it's just 9 a.m. and people are getting settled. So we'll start here in about 2 or 3 minutes with some updates for our region, and then we're going to start talking through with our panelists about the legislative updates and things going on in Texas that are impacting the 1115 waiver and all the work we've been doing. Okay, so I think we'll go ahead and get started this morning. Thank you everyone for joining. We really appreciate it. It's been a little while since we've had one of these calls with everything going on, so it's really nice to be on the phone with everyone. So as I mentioned, we're going to do some region updates this morning first, and then we will hand it over to our panel to talk about everything going on in Texas with legislative updates and the 1115 waiver extension and sort of all of the moving pieces that we've been hearing about for the last few months. So everyone should have received the agenda via our weekly email the other day, but if you didn't, please feel free to let me know. I'm happy to forward that while we're on the call or right after. So just let me know if you didn't receive that yet. So just a few updates. So anyone who received an NMI from April reporting with DY10 round 1, you should have received that email on Monday the 16th. From HHSC. You can also find the updates on the status for everything you reported in the district reporting tool in the reports tab. And if you need help figuring out how to pull that, I'm happy to help you if you didn't receive that email from HHSC. For those who did receive NMI responses, which I think we only had 3 organizations in our region who did receive NMIs, we do need to complete those updates and then upload the new updated templates into the reporting tool no later than Friday, July 16th at midnight. So we have a few weeks until that deadline's coming, but to start working on those quickly so that you make sure you have everything ready for the deadline and the reporting period to make sure that you don't lose any funds or have any impacts from that NMI. And if there's anything you need as you're completing those NMIs or have any questions for the Anchor team, please feel free to reach out via the Anchor box. We're happy to help. Cost and savings. So I know that this has been one we've been talking about for a while, and we did our webinar on the cost and savings guidance that's been released so far, since this is going to be due with our October report for DY10 round 2 reporting in just a few months. We did meet with HHSC on Friday, and this question came up from almost every region as to when this template would be available, since we know what a big lift this is. We have been told it should be available before the end of the month, that they were actively working on it. I think there was a bug in the template that they had received. So they were working on fixing that and want to get that out as soon as possible. And again, their advice to everyone on cost and savings has just been that it will be very similar to what we did last time. So if you're already thinking through pulling data and information for your updated cost and savings, that you can really should be able to start that process. And the template will just be a slightly different format for reporting that information. And so again, we should be seeing that very quickly, but I know people have been very anxious to get started on cost and savings. So as soon as we see that template come out, we'll be sure to email everyone and let you guys know that that template is available for you to start using to be able to complete this. And again, the Anchor team, as you start going through this, is here to help with any questions you have with the new template or the process and guidance around this. Hopefully, since we've all done this once before, it won't be as difficult as the last time, but with having to analyze a new activity, I know people may run into some challenges. And so we're happy to help you guys triage that or talk through ideas with that as we get closer to that reporting period due date in October, since that will come up quickly, I'm sure, with summer holidays and everything else that goes on in the summer. People get pretty busy. So a few updates on the new DY11 directed payment programs. So the district team is coordinating with their internal teams on the development of the reporting timelines that have been discussed. So at this point, they are still planning on doing reporting for these activities for whichever you've been applied for and been approved for in both October and April. And they are aware that that is going to overlap with our district reporting both for October and then for the 2022 calendar year, with finalizing the district reports in April and October for that, as well as we close everything out. They are working on some more detailed timelines to look at what requirements will be due for this coming October, so people can start to get that ready and start thinking about how that may shift from the things you already pull on district. But they didn't have a lot of information on this yet, since it's still working on being finalized and approved by CMS. So I anticipate we'll hear more on this as the summer goes on, but really just something to be thinking about, really digging into those measure guides that HHSC has posted for the programs that you've applied for and been approved for will be a good start to think through what data do you need to start being able to pull for that October reporting. And one important thing on the DPP programs is there is not going to be carry forward on these programs for these measures. So while district, we've really had the ability to carry things forward, we haven't achieved in the past and give us a little bit more time with these items. That's not something that's built into the DBP program. So that's a pretty significant shift when we think about the reporting and the requirements for getting that data pulled in a very timely manner for those reports. So just something to think about as you're building out your processes around these for both CHIRP, TIPS, RAPS, and then the behavioral health programs. So it's a significant change, and one that I think will be beneficial for your teams to start thinking through how that may impact your internal operations. And so IGT went out for all of the programs. So the IGT calls are complete for all 4 of those programs, and all of that information did go out. The provider finance is going to be finalizing the models based on actual IGT collection and the MCO rates. The previous models that they had put out were their anticipated models, so that may change a little bit now that they have all of the final numbers in and final participants. So those will be posted on the individual DPP websites and provider finance. And each program does now have its own website, and those links are in the agenda so that you can access those if you're participating in one of those programs. All of that information is no longer going to be housed on the district transition webpage, but instead on the DPP individual web pages for each program. So you guys can find all of that information there. And again, the links are in our agenda for you to reference if you need those and don't have those yet. So the DY10 milestone 10 deliverable from HHSC is to secure the structure for what the regional healthcare partnership is going to look like post DSRIP. And so HHSC is actively working on this. They didn't have a lot of information for us at this point in time in terms of what will the anchor entities look like and what do these regional structures look like moving forward as we leave the district program and move into these new programs under the new waiver and the DPP programs. But thus far, what they're proposing is that in DY11, the anchor entities are going to continue to support our providers as we complete out our year 10 reporting through the year 2022, and really continue to provide this service to all of you in the region as you need to finish out all of your district reporting, quality measure reporting, et cetera, for the next year. And then that's going to transition into a new function for these regions. And HHSC wasn't able to provide much more information on what that will look like starting in year 12. But they're currently working on options for that, and they're going to engage some regional stakeholders for these conversations. And we're hoping that they'll be engaging all of the anchor teams as well to talk through what the needs are going to be for our regional providers as you move into these new programs. So we're anticipating more to come on this, but again, we don't have a lot of information at this point in time as HHSC is still actively working on this with their internal teams and also with their conversations with CMS and the new 1115 waiver application. And then the last thing is just the partner engagement meeting and executive waiver committee meetings that we have quarterly with HHSC. So for this quarter, those meetings are going to be combined into a single meeting. Normally they are 2 separate meetings, and they're going to be held on June 22nd at 2 p.m. We included the link to register for these meetings in the agenda, and you should receive an email confirmation for that registration once you go ahead and register. You can also, there's a link in there if you'd like to be added to the email distribution list from HHSC on these, so that you can stay in the loop as to when these meetings are happening. I haven't seen an agenda for this yet, but once I do, I'll make sure that I share it with the region. And again, you're able to register to attend this meeting to get all of those updates that are going on from HHSC directly for those 2 meetings in that combined meeting agenda. And then on the agenda, I also included just a list of upcoming dates for June through August, so that you just have some insight into the district dates. Again, these don't really include the DPP dates. We're waiting on that. But we don't have much insight into that yet for what that's going to look like. But the highlights there are really the NMI date that I highlighted earlier in July, that you guys will need to have all of your NMIs done. And then IGT settlement for April will be in early July as well. So those are sort of the 2 forthcoming items in July, so that we can get all of that settled out, and then district payments going out at the end of July for our April reporting process. So a lot of updates today. We haven't met in a while. A lot that's still to come from HHSC that we're waiting on, especially in regards to more detailed timelines with DPP, and then cost and savings, which is a really big one for October as everyone thinks through that process. But we'll be sure to keep everyone informed as soon as we're getting updates from HHSC, so that you guys have the most up-to-date information that we get. I'd like to open it up to any questions anyone has about any of the updates or anything going on in district before we hand it over to do our panel discussion on all of the legislative updates and goings on in Medicaid across the nation. So does anyone have any questions before I hand it over to our panel? I don't see any questions in our chat box, and I think you should be able to unmute yourself if you have a question, or please feel free to use the chat function or the Q&A function to type it in. Okay, so at this point, I don't see any questions, so I'm going to introduce our moderator, but if you do have any questions as things come up, please feel free to put them in the chat box or send an email to the anchor box, and we're happy to touch base offline as well. So I'd like to introduce this morning Freddie Warner. Freddie joined Memorial Hermann Health System in 2008 and serves as the Chief Government Relations Officer. He's responsible for federal, state, and local advocacy. Before coming to Memorial Hermann, he spent more than 20 years as government relations, regulatory, business development consultant, working in a variety of legislative, campaign, and regulatory capacities in more than 20 U.S. states and in Washington, D.C., with a particular emphasis on the state of Texas. And for 3 years, he was Vice President of Government Affairs for the largest building materials company in the United States. Over the course of his career, he's represented numerous clients before federal, state, and local elective bodies and regulatory entities, managed greenfield development projects, developed strategic plans, and created community investment and media campaigns for his client. He previously served as senior campaign and legislative capacities for a member of the Texas Congressional Delegation, a Texas state senator, and the Texas lieutenant governor. He holds undergraduate degrees in journalism and political science from Southern Methodist University and a law degree from South Texas College. So I'd like to welcome Freddie today. He's going to serve as the moderator for our panel, and we are very excited to have you join us today. So I'll let you introduce our panel. Thanks so much, Freddie.
Very good. Thank you, Sarah. We got a great panel today. I'd like to quickly tell you who's going to be participating as panelists today. Anna Stelter is the Senior Director of Policy Analysis for the Texas Hospital Association. She's responsible for all of the healthcare financing and quality issues, and also supports all of the association's activities relating to hospital payments to Medicaid and state budget. On a personal note, she was the point person for THA throughout the legislative session on all the fiscal matters, and did a great job over the course of the legislative session. I want to introduce John Henderson as well. John is the president and CEO of the Texas Organization of Rural and Community Hospitals. TORCH is comprised of 158 rural hospitals And before coming to Torch, John actually served as a hospital CEO for his hometown hospital, Childress Regional, and was in that role for 16 years. During the time he was at Childress, he also was the chairman of both Torch and the Texas Hospital Association. Lee Johnson serves as the deputy director for the Texas Council of Community Centers, which is a state association representing the 39 community centers in Texas. In that role, Lee advises the centers on legislative strategy, appropriations issues, strategic communications, public policy development, and implementation. I appreciate the fact that prior to coming to the Texas Council, he served in a senior legislative capacity for a member of the Texas legislature. And finally, we've got Jennifer Flynn. Jennifer is the Senior Director of State Affairs for Premier Incorporated. She's a respected policy expert who has more than 20 years of advocacy experience in both corporate and association settings. She works with Premier's members and governmental affairs network members in managing and influencing state legislative issues and positioning Premier's alliance at the state level as a national leader and resource in achieving measurable improvements in healthcare performance. So I hate to read bios, but those are our panelists for the morning. And with that, what I'd propose is I'd like to start out by giving each of y'all an opportunity to share any observations you have regarding the recently concluded legislative session. And Jennifer, particularly from your perspective, any observations you've got regarding the 117th session of Congress and the new administration this year. So Jennifer, why don't we start with you from a national perspective, and then we'll drill down to the state level.
Sure. Thanks so much. Yeah, it's going to be an interesting year. So I'd say with the new administration coming in, if we're looking at CMS and CMMI, obviously we're well aware that there's a new perspective on waivers in general. Medicaid waivers, specifically work requirements, are not something that's going to move forward as it relates to Medicaid expansion. The administration is going to focus heavily on the states that have not expanded Medicaid and trying to put out some carrots, possibly. There's already the 5% bump under the legislation that passed, but I think we're going to actually see some more possible carrots in that line. And as it relates to waivers in general, there is a discussion going on now about what type of flexibilities might be out there that CMS would consider for states to do something in regards to health equity and social determinants. That's the area that there's a lot of focus on. And there's also a lot of discussion about models that would not necessarily be all payer, but an alignment of payers. So that, let's just say, Medicaid and Medicare and maybe some commercial plans would have an alignment of measures so that you don't feel like you're jumping through 15 different hoops for every single payer that you're dealing with. And how that they would go about doing something like that in a waiver environment maybe, or another way, we're not quite sure yet. But CMS is really focused on those areas. As it relates to Congress, it's going to be basically, there's going to be the budget, and there's going to be a lot of discussion about what's in the budget and how they do all that all of this summer. And the way that we see it right now, nothing is going to even be touched until the fall. So really, it's going to be a summer of, they're gone for August, a battle over the provisions in the budget. And then you'll start to see things move, hopefully, the latter part of the year. There are a couple of areas where we see things might move, but as you are probably aware, there are some very hard and clear divisions right now that really have to be overcome before anything is going to go anywhere. We think things like maternal health might be incorporated into some larger bills, not standalones, but that's an area where there seems to be some bipartisanship. Things about infrastructure, the administration obviously is pushing hard on that. And then, of course, anything related to COVID relief and those types of things. But for now, it's going to be a very, quote, contentious summer, but you're not going to really see anything happen until the fall.
Gotcha. John Henderson, from your perspective, you got a statewide perspective, but also looking at this from the perspective of the impact on the rural providers. How do you view the legislative session, and how do you view what's been going on in DC?
Well, looking back from DC, rural hospitals got some targeted federal stimulus, which was certainly helpful and probably helped us avoid closures or a continuation of the closure process specific to rural Texas. But our CEOs say that most of that money's now gone, and they limped into the pandemic and they're going to limp out of it. With regard to the state legislative session that just ended, Freddie, probably you and Lee know this better than me. It's only my second session, but people say every session is different. I kind of viewed the 2019 session as responsible governance, and the 2021 session was quite different. Republican leadership was confident in 2021, to say the least. So the to-do list was very conservative. The other thing that we thought that the pandemic and the winter storm were going to be major factors, and they probably were, but the biggest factor in my view was the evolving budget forecast. And so last summer, it was dreadful, not just COVID and unemployment, but a dip in oil and gas prices, which are so important. That improved in January from like $4 or $5 billion deficit to less than $1 billion deficit. And then maybe in April or May, actually, we flipped positive without the federal stimulus dollars. So that budget shift was a major factor during the session. We had a pretty simple legislative priority to-do list of 3 things. Medicaid rates, we support expansion, but less vocally than some others. We focused on rates, and actually through the budget process had success there, not just continuation of the rural appropriations from the 2019 session, but some new Medicaid dollars flowing to rural that'll be very helpful, get us pretty close to cost actually, which is not great, but I would say our rural Medicaid rates don't suck as bad as urban Medicaid rates. Number 2 priority was around telehealth and broadband, and there was broad bipartisan support of both HB4 and 5, our telehealth bill, and then the broadband, creation of the broadband office, which will be in the comptroller's office, and see those as helpful. And then our 3rd priority was around the waiver, which this group knows more about probably than I do. We started in January feeling pretty good about that, but during the session, got the cancellation and now the reapplication. So that one we're actually still working on. All things considered, I'd say is a pretty good session for rural Texas hospitals and the people that I work for. But there's clearly a lot of work left to be done.
Gotcha. Lee, how about your perspective from the perspective of the community centers?
Yeah, Freddie, I appreciate that. And, I won't, repeat everything that John said, but I mean, I think he's absolutely right. I've been involved in 8 legislative sessions with the Texas Council and 2 before that. So I've been around this process for a while. And this session was really unlike anything I've ever seen. And, it started, I would have to describe to my friends and family that going to the Texas Capitol building was like being in that movie Outbreak. If you've seen that, you've got these military tents that you walked into and you had to get your COVID test. And then, of course, everyone was masked up in the beginning, in the early part of the session. And that sort of dissipated, as more vaccine became available and the restrictions at the Capitol were loosened. But this was really a session like no other. And John, you're absolutely right. Every session's a little bit different. And so, I think this one for me will forever be an asterisk to say, gosh, that was just a wild ride. So, for us, I mean, in many respects, seeing what the budget outlook looked like in July, when we started to get some good data from the controller's office, last year, it was really a great concern. And I think, like a lot of associations, we kept our agenda very simple because we were anticipating, some pretty substantial challenges with the budget. So when the controller's revenue estimate was released just prior to the start of the session, I mean, oh my gosh, it was like everyone's prayers had been answered. You know, the situation looked dramatically different than we thought it would, but still it was not without challenge. And so again, we kept our agenda quite simple. From a budgetary standpoint, you know, this session, I was greatly pleased to see that the legislature maintained their investment in outpatient treatment for adults and children on the behavioral health side. In addition, maintaining investments in substance use disorder services. They maintained the crisis response system that we have in Texas. They also maintained some highly effective mental health grant programs that have been in place now for about 4 years. So there are a number of positive things to see in the state budget. In addition, they included some budget riders that we think will be really important for the future. So first among them is an inclusion of an additional $30 million for locally purchased inpatient psychiatric bed capacity. So this is funding that our members, the local mental health authorities, use to locally purchase inpatient capacity at private psychiatric hospitals across the state. This, of course, is hugely important to mental health services because the state hospital system is really very limited in what it can do for folks. In addition, and this really kind of spans the state budget, but also the supplemental appropriations bill, we saw continued investment in state hospital redesign. So this will, of course, result in additional funds to complete the project in Houston at HCPC, which is a fantastic step in the right direction. As well, projects at the Austin State Hospital, San Antonio State Hospital, and then planning funds for a new hospital in North Texas. So this is the third in a series of investments the legislature has made over the last few sessions. So we're really encouraged to see them continue that smart investment. And then one, I would just point out a rider that was included around 988, which is an effort at the federal level around the National Suicide Prevention Hotline. There is currently a planning grant process that's unfolding in Texas. Texas was one of many, many states across the country to receive a planning grant to better organize how the crisis response system is able to respond when those calls come in. So today, we have 24/7 access to crisis hotlines in every county across the state of Texas. And in the future, 988 will be a 3-digit number that folks can access when they're experiencing a psychiatric emergency. So this planning grant process that's underway now is aimed at looking at how do we better align these things so that when someone calls 988, there's technology in place to route them to the appropriate locations and local service providers. So all of that effort is underway now, and this rider will require the work of that planning grant process to be reported back to the legislature in anticipation of the next session. So that's really important work. And then, you know, in addition, I would say, you know, again, we kept our agenda simple, but certainly telehealth was a huge priority for our members. Very encouraged to see that Governor Abbott signed House Bill 4 yesterday, which is a bill that will continue the flexibilities that we've been able to utilize during the COVID-19 pandemic. So some of you, I'm sure, on the line are familiar with the fact that in our system, in a very short period of time during the height of the pandemic, we moved from, you know, better than 95% service delivery to better than 95% remote delivery. That was through telehealth and telemedicine, which of course the 1115 waiver was very helpful in providing that kind of technology and infrastructure to have that capacity. So we moved very quickly to maintain access to care when social distancing and other measures were being implemented that prevented face-to-face service delivery. So House Bill 4 is a great step in the right direction. It, of course, is going to recognize cost effectiveness and client choice in that. You know, we've heard from our folks in our system across the state that having that option is a really important thing. So we were encouraged to see that bill signed. And so, you know, of course, the 1115 waiver is a big priority. And I know, Freddie, we're going to have some more questions as we get into this discussion. And I'm glad to talk about that more in detail later in the presentation.
Sounds good. Anna, how about you? This was your first legislative session at THA. You're certainly a veteran, having spent some time at TMA before that in the the Texas Health Institute. What was your observation of the state legislative session?
Hi, good morning, everyone. I think John and Lee did a great job capturing the dynamics that we were faced with at the Hospital Association and you know, with our partners in this work. You know, I will be brief because I think they covered it really well. But you know, my sense of things is that, you know, we were, as a hospital association, just continually in awe of our members this session with COVID. When we first encountered COVID in March of last year in Texas, our first case was confirmed on March 4th of 2020 in the state. Our members since that time have absolutely stepped up to the plate, bent over backwards, jumped through hoops during, you know, the entirety of a pandemic, during an unprecedented winter storm where certain hospitals were told they would be placed on rolling blackouts to keep all the patient care online. When vaccines rolled out, we saw hospitals create really innovative ways to get vaccines into their communities and to vaccinate all their staff, keep patients safe. So there's just more examples than I can ever think of healthcare and hospitals stepping up to the plate and performing and being leaders in their communities. And despite that, you know, hospitals really kind of had to fight uphill during this session for a lot of things that you wouldn't normally expect. We had to play defense on a lot of things that would not be good for hospitals, that you know, moved a little farther than you would have expected it to in a normal session. So we just saw a lot of interesting things playing out under the pink dome that you know, I haven't been at THA for more than one session, but my colleagues will unanimously reiterate that it was kind of unusual. So you know, just to comment on the budget piece specifically, we were coming along at a $2.9 billion surplus projection around early 2020, and when that was revised downward to a negative $4.6 billion shortfall, I think you could hear all of Texas and everyone in government relations heart jump up into their throats, because that would rival just about the ugliest kind of budget outlook that we had seen in at least a decade, if not longer. And so as that budget outlook improved, things did get a little better. But what I kind of want to add on to what Lee and John said is that, you know, those initial projections resulted in state agencies being asked to reduce their budgets. There were a few health-related areas held harmless, but a lot were not. And because of those initial estimates, kind of the wonky kind of domino effect of that is that it affected kind of constitutional spending limits and other things. So the result was that a lot of those 5% reductions in response to the initial economic downturn were never really put back, even as we got relief from federal money, even as we got a better budget outlook. So there are things that were really vulnerable through the entirety of the process, even though we started seeing improvements that we would expect to kind of help us not have as ugly of a you know, a final budget and have an ugly budget fight, you know, throughout the session. So there were things that we really did have to step up and just fight to maintain. And I think we were successful at that. We maintained level funding for hospital rate enhancements. As John said, there was an additional rate enhancement for rural hospitals that was really big. Those investments in state hospital funding that Lee mentioned out of the rainy day fund and our supplemental budget. There were a slight increase in funds made in investments in women's health and family planning programs. So there were some big budget wins that were secured in spite of really the roller coaster that we went on over the biennial budget cycle. Obviously, in the middle of that, the waiver, I think we're going to get into that a little bit, but that created a lot of budget uncertainty. It set a completely different tone for coverage expansion conversations as we moved through the session. You know, I think we can point to some areas that there was progress made in the conversation around coverage, but when you like look at the scoreboard, so to speak, there was not really advancement on getting toward an end product. We, you know, the bill that would have, the Live Well Texas plan did not get a hearing in the committee that it had been referred to in the House. The budget amendment discussion failed on a mostly party line vote, and there was really a party line, you know, the attempts in the Senate kind of all failed on party line votes as well. So it was just a little disappointing not to see a better outcome kind of on the score sheet with that. I will go ahead and pause there and turn it back over to you, Freddie.
So let's stay on the subject of coverage expansion or Medicaid expansion. I think, for those of us in the hospital setting, we were probably as enthusiastic, if not more so, coming out of the 2019 legislative session, looking ahead to the 2020 election cycle and going into 2021. A lot of enthusiasm, and it seemed as if there was a greater amount of business community support manifested across the state. To have organizations like Texas 2036, the Metro 8 chambers, the business community carrying some of our messages forward. So it wasn't just the usual, John, I'm thinking we're constantly the self-serving message coming from health and human services providers. What else are we going to ask for but expansion of coverage? But to be able to have the business community behind us seemed to really create a lot of enthusiasm. I also was really gratified to see a number of Republican lawmakers during the interim basically saying we need to do something about this. And then when Dave Phelan was clear he was going to be the new speaker, we had an event for him in Houston at which he said it's hard for a Republican leader to defend the highest uninsured rate of any state in the country. We need to do something about this. And at the end of the day, no coverage expansion legislation passed. Do you all think that, well, I really have two questions. Do you think Texas is ever going to expand its Medicaid program as it was contemplated into the ACA? But also, do you think we're going to have to just rely upon a series of incremental opportunities going forward, such as were addressed this session? What are y'all's thoughts about coverage or Medicaid expansion going forward? Henderson, I'm going to pick on you if nobody says anything. What do you
Hey, I'll jump in. I'll jump in there first, Freddie, and I agree with you 100% about the business community and even some bipartisan support in the House. But there was never a path through the Senate. There was never a path through the governor's office. And with regard to your questions, I mean, I remember thinking when the Supreme Court ruling came down that Medicaid expansion can't be forced, that Texas was going to be at the end of that line. And so I think the practical reality, no matter how good a deal it is, we get snagged in the politics, and we're going to have to live with incremental improvement until everybody jumps. And I just think Texas is going to be the last state to do that. And it saddens me a little bit because we are supportive, and the math is clear. It's a good deal. The politics are messy.
Lee, any thoughts about coverage expansion going forward?
I would echo what John said. I mean, what is really clear in this discussion and in the experiences that we saw unfold during the legislative session, I think from what I saw, reading the newspapers and conversations and reading tea leaves, there was an impression that the withdrawal of the extension would cause enough pressure to force the legislature to take some action, and clearly that didn't happen. I remain, well, I'll say this as an association, the Texas Council has always supported access to care. And increasing access to care, and we've left decisions about how to do that to the legislative leadership in the state, right? That decision's above our pay grade, but we have long supported increasing access to care. So looking ahead, I mean, I think John's absolutely right. The politics of this are just so difficult. I'm really encouraged to see what's unfolded in the public hearing process. Relative to the resubmission, we have, of course, very supportive of resubmitting the application for the 1115 waiver extension. There's some really important programs in there. And of course, from a system perspective, the public mental health system, of course, all 39 of our members have participated in 1115 waiver since 2011. In fiscal year 20, the district dollars that have come to the public mental health system represent better than $366 million per year, serving more than 290,000 Texans with serious mental illness. And of course, as you all know, district goes away on the end of September of 2021. So just a few months away. And so, this is a circumstance in which we're really supportive of the resubmission. And we're hopeful that the state and CMS will be able to negotiate something that will allow us to maintain budget neutrality that was previously agreed to, that would allow the public health provider charity care program that was included in that extension to continue into the future. Those are really important efforts. And then, of course, all the directed payment programs that are included in that waiver submission, because it's a circumstance in which so much good work has been accomplished through the district program in Texas. As a state, this is much bigger than just our system, of course, but as a state, we've got to figure out a way to sustain that work. And so, again, I'm encouraged to see a lot of the stakeholders involved in those public hearings reiterating the fact that we do need both. We need a sustainable, uncompensated care program, and then conversations about coverage and what that looks like into the future. So, but John's absolutely right. The politics of this are quite difficult.
I think about Jennifer, take a look at this from a national perspective. I know Texas is not the only non-expansion state. It seems like we're the one that's perhaps we're the most politically dug in. I always think about the fact our current governor was the lead plaintiff's attorney general in the case that went to the Supreme Court in 2012 when Rick Perry was governor. Now look forward, he's the governor. But you're seeing this from the perspective of many other states as well. How do you see some of the non-expansion states addressing these issues?
Yeah, it's a great point. I think, it depends on who you ask in the state, because from what we've seen from, if you will, the populace of the states through some of the voting that's gone on, the population is in favor, for the most part, of Medicaid expansion. So they've voted for it. They've put it on ballots, like in Missouri, where it passed, and then the legislature didn't fund it. And now it's going to go to the courts to figure out how that ends up. So there absolutely is a stalemate in many states. And, as we saw with the 5% bump that was put out there for FMAP, none of the states in the legislative session, this past legislative session, took that up that hadn't expanded. None of them passed Medicaid expansion, even though they were going to get that 5%. And that was the carrot that was dangled for states who hadn't expanded. And there was a hope that at least some of them would take that up. I think obviously I'm not in Texas. I'm sure you guys have forgotten more than I will ever know. But I think the political divides that currently exist in many states, not just Texas, I think it's going to stop any real movement forward unless you see it on a ballot in states where they can do that, or the administration is going to have to come up with something much more feasible and much more attractive. Now, what that is and how that looks, I don't know yet. But if there was something else, some kind of flexibility, something that allowed for more of the state input, I think that's what it would take. Otherwise, yeah, I don't see it passing anytime soon.
Gotcha. So Anna, let's talk about the 1115 waiver and the circumstances at this point. So we've got, an extension granted second week in January. We've got the extension rescinded second week in April. We've got a recent reapplication of an 1115 waiver renewal. And at the same time, we've got the state of Texas suing the federal government relative to the rescission decision. So how do you see the issue of the new waiver application playing out going forward? And I'm going to direct the question to all the panelists, but Anna, starting with you from THA's perspective, how are you seeing the new application playing out?
Good question. You're correct. It was a little bit up and down, and it coincided right with the timing of session beginning, and then session getting to kind of its peak intensity, and all of the activity with the waiver was kind of right in lockstep with that, and it made things really interesting. I think just from what we're hearing from HHSC, they have been holding public hearings over the waiver the last couple of weeks. they intend to resubmit basically the identical deal that they got approved in January, even though that was not what they initially applied with back in November. So I think they're hoping to kind of get an identical yes, or that's going to be the ask going in, is that CMS honor the terms. The reason given for the rescission was essentially kind of a mea culpa by CMS on the lack of federal public comment, and so it was a little bit of like a technical reason given for why the initial rescission decision was taken the way that it was, and so I believe the state's hope is that, because if they follow the steps of public comment to the way that CMS prescribes, that they will, that there was not an issue really raised with the actual contents of the waiver in the rescission decision. So I think that's kind of the hope going in. Now, those negotiations probably won't begin until later this summer, after the federal public comment period closes, and I think they're going to have to come back to the table and expect, with I think with someone with a little bit of an ear closer to the federal side might be able to comment on this, but there's going to be a new set of folks at the table, and I don't know that they yet have a handle on what are going to be the priorities of the new administration coming in with this waiver, and what's going to be the tone of those negotiations. As far as the directed payment programs, which are kind of being negotiated on a parallel but separate timeline, and those are scheduled to start on September 1st. And they really kind of have an accelerated urgency because of the wind down of DSRIP. Those negotiations are ongoing, and it doesn't appear that the lawsuit you mentioned or anything else has had an effect on the progress of those negotiations, which is great. And we want to see those continue to be stood up. We want to see that transition from DSRIP be as seamless as possible, and with as minimal disruption as possible to the great work that's going on. So I think that's where things stand right now, and I think our hope as THA is that we can see the state maintain that favorable budget neutrality determination that we got in the waiver, that basically allows the state to put a lot of resources into the district transition programs, that allows the state to carry forward some savings, gives the state plenty of room and plenty of resources to do what it needs to do, to continue to fund a strong uncompensated care pool, to continue to fund a behavioral health safety net, and continue to make those rate enhancements available through the directed payment programs.
John Henderson, from a rural perspective, what are your prospects for the waiver going forward? I know I've got to believe that your organization that leads, everybody's obviously preparing comments for their respective members, but what are your observations currently? What do you think is going to happen going forward?
Yeah, I actually commented yesterday and made the point, there were a lot of people talking about Medicaid expansion. And I commented that we support that with two caveats, which is, number one, we realize the commission is not driving that bus. And number two, even the most optimistic estimates show that that's like a 25% solution to the uncompensated care problem in Texas, and that we advocate for 100% solutions, which require expansion and waiver renewal. I think, going back to a point Jennifer made about ballot initiatives, I think ballot initiatives in other states are undefeated, and that might be a realistic path for Texas, but anything short of that just isn't going to pass. And anyone who actually thought a rescission or cancellation decision by the Biden administration would force Texas to expand Medicaid doesn't know Texas. And the elected officials I spoke with actually viewed that as a gift. I mean, what they said was, we've been telling, their strongest point is, we've been telling you, you can't trust Washington, and they'll pull the rug out from under you and change the deal. So even if the math looks good, it could change tomorrow based on, their budget forecast. And so we're in a tough spot. I don't like making predictions. I lean favorable on some sort of waiver extension, even though if I were in DC, the answer to every problem would be, you got to expand Medicaid. I don't think they'll push Texas off a cliff. I would expect something like 5 years instead of 10, hopefully with budget neutrality. And that lets us, kick the can down the road a little bit longer.
So John, I'll ask you, and I've same question for Lee. relative to what might be negotiated, what would you think about the potential to have a delay of a year or perhaps two with respect to district wind down, kind of given the, given the uncertainty that we have with restarting waiver negotiations?
You want me or John to take that one, Freddie?
Lee, please.
Well, I mean, certainly, I think as I think about what DSRIP has meant for the public mental health system, you're talking about, and I mentioned the numbers, but when you think about the types of services that are now a part of that effort, you're looking at like services that integrate physical and behavioral health care, expanded access to treatment in rural, frontier, and underserved areas. Evidence-based interventions for people with serious mental illness, crisis stabilization, mobile crisis outreach teams. The DSRIP program has really been an incredible game changer and has allowed the public mental health system to do things that it was not funded to do for a very long time, and really address some of those unique local challenges. So, I'm hopeful that we're going to get to a good place here in the negotiations that unfold. And I think, what I will continue to say and what I've been really encouraged to see in all the stakeholder meetings that have unfolded to this point, we're not just hearing from, people from our system, but we're hearing from many others. Yesterday in the hearing that they had, local officials testified, local elected officials, others, I think will, hear more of that in written comment as well. But just really encouraged to hear folks weighing in about how much of a benefit DSRIP has been and how incredibly important it is that we figure out a way to sustain that. So, if there was a temporary extension of DSRIP or something along those lines, certainly that would be a step in the right direction. Again, a lot of those decisions are going to happen in the negotiation, and that stuff's of course above our pay grade. But I'm really hopeful that we're going to get to a good place here. It's such a big issue, and it's much bigger than just our system. It's the entire state of Texas and the public health infrastructure that we have here. So we've got to get to a good place on it.
Very good. I understand that Sarah has got a couple of questions in the chat that she's going to provide for our panelists. Sarah?
We do. Thanks so much, everyone. So we have a few questions from the group, and for everyone listening, please feel free to put any additional questions in either the QA box or the chat, and we'll get to them. This one I think will be interesting for both Jennifer and our other panelists on the Texas perspective. They asked, Medicaid expansion will not cover things like behavioral health needs, patient navigation, care transitions, and interventions on social determinants of health that were huge successes during DSRIP. I've heard CMS is very unlikely to allow 1115 waivers to continue that do not address social determinants of health. What are your insights on that? So Jennifer, I don't know if you want to take this first with your comments around health equity and some of the things you're hearing out of the administration thinking about, and kind of the social determinants of health aspect that Texas has been focused on through this waiver for the last 10 years.
Yeah, it's a great question. And I actually think it will, I think it will bode well in the negotiations for the 1115 waiver extension that you guys are having, because the fact is you have done a great amount of work in that space and have excellent results. So I think CMS definitely wants to hear that. But I absolutely agree. There's not Chiquita Brooks LaShore, who is now the head of CMS, literally said the first question that I will ask every single person that comes to talk to me is, how does this promote health equity? So in every discussion that you're having with CMS about waivers, about programs, it doesn't matter. It has to have a component of health equity and social determinants and how you're going to address those things. I think there absolutely is an openness to have some type of waiver or through a state plan amendment that addresses those types of concerns. And there may even be funding opportunities behind that. Whether or not that's going to be a quote DSRIP 2.0, I doubt it. I don't think it'll be like that, but I think there absolutely will be, they'll be open to discussions about coming up with pilots or programs that will achieve health equity outcomes with possibly funding attached. So that may be something that, comes up in the negotiations for the extension.
Thanks, Jennifer. Do any of our other panelists want to comment from the Texas perspective on kind of the social determinants of health and health equity aspects of everything going on with these negotiations and legislative sessions?
Yeah, absolutely. If I could weigh in from a behavioral health perspective, so the person that asked that question is really spot on, and I would point out, since 2015, the state has been pursuing a recognized at the federal level as a best practice model of care called the Certified Community Behavioral Health Clinic Model of Care. And the state of Texas, the legislature directed the Health and Human Services Commission to pursue this model of care because it is recognized at the federal level as a best practice. And I think what we've seen over the years is we've seen an alignment that's happening with the district program and outcome measures associated with that. But for example, the CCBHC model of care, it requires access to crisis mental health services, 24-hour mobile crisis teams, emergency response, screening, assessment, and diagnosis, including risk assessment, patient-centered treatment planning, and similar processes, including crisis planning, outpatient mental health and substance use services, outpatient primary care screening, and monitoring of key health indicators. So as we think about, how the state has utilized the 1115 waiver. Today in Texas, 25 of our 39 members are now certified as CCBHCs. Of course, the Harris Center in Houston is a certified center. And this is a very important model of care. The 1115 waiver and district funding has allowed us to expand this model of care in Texas. And so again, ever more important that as we think about what the public health provider charity care program and the directed payment program for behavioral health services means in a waiver extension, that we're looking at, how those programs moving forward can better help us to the greatest extent possible maintain what's been accomplished in district and implementation of this model. But the CCBHC model of care is certainly focused on the social determinants of health. And the process to continue to expand this model in Texas will hopefully be something that CMS looks quite favorably upon.
Thank you so much for both of those perspectives. I think that was really insightful for our group. So we also have a question about HB4 that some people commented on before. Specifically, did it include all telehealth accommodations to continue past the public health emergency, or is it just some of the provisions that were included in that and some were excluded?
Yeah, Sarah, I tried to include this in the text box, but for some reason I couldn't hit send on it. It's quite broad. I'm not looking at the full list of all the accommodations that were made for the public health emergency, but Section 2 of the legislation, it really is quite broad. And if you go and take a look at that, you'll see all the services that are included. And then, of course, the Executive Commissioner of Health and Human Services Commission will have the latitude to determine cost effectiveness and clinical effectiveness of service modalities that may become options under this telehealth provision.
And I know we're running out of time, Sarah, but a more focused view of HB4, the thing that mattered to our rural members is a provision that allows distant site telemedicine in a rural health clinic the way FQHCs gained the ability to do that last session. And that's in Medicaid, of course, only, but also has nothing to do with the public health emergency.
That's great, thank you. So one more question from someone was that they said our district projects have been very successful. We've implemented these in partnerships with our local county health department. I was disappointed to see very little funding in the waiver extension allocated to county health departments. Any thoughts on this?
Yeah, so I'll take a stab at it at a very high level. I think the public health provider charity care program, if you see how that was initially structured in the presentations that HHSC provided when the extension was initially granted, it includes a portion for based on historical DSRIP, right, for the public health departments, which I think is around $100 million. And again, I mean, that pool was developed based on historical performance in DSRIP. But it does going forward, if assuming we're successful in the negotiations between the state and federal governments. It includes provisions for resizing as that program unfolds. So it's set at 500 million in total for the first 2 years. But then it's anticipated that there will be additional resizing into the future. So I think that'll be something really important. Certainly the public health departments and local health departments across the state have done some really innovative things with DSRIP. And those initiatives should absolutely be considered. And I know that the Association for the Public Health Departments has been engaged in a lot of those conversations. So I would anticipate that moving forward, folks at the Health and Human Services Commission will be paying close attention to that.
Thank you so much for that, Lee.
You
So
bet.
I know we're at time now, it's about 10 a.m., but for all of our RHP3 providers who are on the call, I did just want to put a plug in. So a lot of our panelists today did mention the public comment period for the 1115 waiver. The last public comment live session was held yesterday. As the anchor team, we are looking to put in some public comments on the 1115 waiver. So if there is anything you'd like us to look at or have included in addition to things that you've already put out there from your own organizations, please email the anchor box this week as we're really looking at putting together something to advocate for our region and everyone who's been participating over the last decade. So with that, I just want to thank all of our panelists today, Freddie for being such a great moderator, excuse me, and everyone else for all of their comments today. I think this was really beneficial for our region to understand all of the intricate ongoings that have been happening in Texas and really how does that align with national work and the new administration coming in. So thank you, everyone. I think this was really enjoyable. And if anyone has any questions after this session for our panelists, please feel free to send them to the anchor box and we can connect you. So thanks, everyone, and enjoy the rest of your Wednesday.
Thank you, guys.
Thanks for having us.
Great day. Bye.